All right. Like to call our first House Health Committee of the year to order. Will the clerk please call the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Fajan, Farmer, Gillespie, Hakeem, Hawk, Haynes, Himmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Chairman, you have a quorum.
All right, thank you. And before we get started, I'd like to welcome everybody back and go over a few things before we get into our calendar. First, I'd like to welcome some new members to our committee. We have Representative Bain, we have Representative Capley, and we have Representative Hill. Where is he? There he is. All right. Also this year, our staff, we have our staff attorneys, Caroline Miller and Alexandra Greenberg with us. And Mike Critchfield is our research analyst again. Megan Dix is our committee assistant. Charles Lolis is our committee intern. He is from Tennessee Tech. Glad to have him with us. Our committee clerks are Anna Yankee and Caitlin Cozart. And our sergeant at arms is Terry Van Trees. So thank you guys for working with us and appreciate the work that you're going to put in for us. And I want to let everybody know that the guidelines will remain the same as we had last year, except there is a new rule in place. So keep in mind that if you are presenting a bill, your opening remarks are up to 5 minutes for the bills. So that's uniform across our committees. And then as a reminder, while it's not a requirement, I ask that members fill out a short information form on their bills. We've had this discussion before that will help assist them with their bills, and it's emailed from our office. So with that, do any of our members have any personal orders? All right, seeing none, let's get into the business of the day. We have 5 items on our agenda. Item number 1, House Bill 1625. Chairman Zachary, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman, and thank you, Representative Mitchell, for the motion. My goodness. Mr. Chairman and committee, I do have an amendment, drafted code 13125, and that's what we discussed in the subcommittee.
All right, so without objection, let's vote on amendment. Okay, motion and second. We are voting on amendment 013125. All those in favor, say aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. Chairman Zachary, you are recognized.
Thank you, Mr. Chairman. Thank you, committee. Members, you'll recognize this bill from last year if you were on this committee. During special session, we passed this bill through the Health Committee to the House floor, passed with bipartisan support. Unfortunately, our friends in the upper chamber decided not to work that week, and so that did not make it through the Senate. So as a reminder, members, currently in statute today, related to duty to warn, there is a requirement for a mental health practitioner to report a clearly identified threat if a threat is made to them in a counseling session. The challenge with the statute, members and Mr. Chairman, is that it was very vague, did not tell them who to report to, and it was very clear, TBI told me it's very clear that it had to be a clearly identified victim. So in the case of what may have happened at Covenant, we do not know for sure. Threats may have been made, but there was no requirement on that mental health practitioner to report because those threats, as some reports have said, may have been vague. So what this particular bill does, Mr. Chairman Committee, it makes the requirements more clear. It tells the mental health practitioner who they're to report to. And so that's in the bill. It says that if it's an imminent and clear threat, they obviously have to call law enforcement. But that also gives them the ability to report to call 988 or report to their local crisis response service. because what mental health practitioners told us is it's important that a mental health practitioner has some flexibility in meeting with a patient, that many of them don't want to engage law enforcement. And we know that because under this current statute, the Sheriff's Association did a informal survey and no one has ever exercised duty to warn that they can find based on their survey. So, Mr. Chairman, again, this gives the mental health practitioner flexibility. If a threat is made during one of their sessions and they can't stop it by their own means, then they can call 988, call the local health agency, or report to law enforcement. This legislation, after working with Behavioral Health Foundation, Tennessee Psychological Association, they support the bill, Mr. Chairman. And then just to close the loop, as you know, this language, the base of this language was brought to me by Covenant Parents. And so after working with them and engaging with them, we were able to work on the language and come to an agreement with the various groups. And I do believe this will save lives. So with that, Mr. Chairman, I'll be glad to answer your questions.
All right. Do we have questions for the sponsor of the bill? Okay. Representative King, you're recognized.
Thank you, Mr. Chairman, and thank you, colleague. Just a point of clarity, the provider of health services in this instance, I don't know if the term should be they are held harmless by doing, making this known, or could you give me some clarity on that?
Yes, sir.
You're recognized.
Thank you, Mr. Chairman. Yeah, great point, Representative Hakeem, and I failed to mention that. So that's one thing we did add as well. It provides civil immunity to any mental health practitioner that does report. Thank you for bringing that up, and that we did include that in the bill.
All right, thank you.
Thank you.
Thank you. Representative Hemmer.
Thank you, Mr. Chairman. Thank you for the bill. Just had one quick question around the 988. I was just curious from what you learned and talked to, what is a 988 professional going to be doing with this threat versus the mental health professional that actually gets it?
You're recognized.
Thank you, Mr. Chairman. It's a check and balance. So you're meeting with a mental health practitioner. They have concerns, so they then call 988. They engage 988, which then in turn could engage law enforcement if necessary. So it's just a check and balance.
Any further questions? All right. Seeing none, we are voting on House Bill 1625. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules as amended. If you wish to be recorded as a no, notify the clerks.
Thank you, Mr. Chairman, committee.
All right, thank you. That brings us to item number 2, House Bill 1639. Chairman Moon, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman.
And you do
and
have an amendment.
members. I have an amendment, drafting code 12324.
You have a motion and a second on the amendment. Let's, if there's no objection, let's go ahead and get that amendment on the bill. All those in favor of amendment 012324, say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Patients have the right to keep their medical records private even after death. HIPAA leaves the definition of personal representative up to the individual state law. A decedent's personal representative is a executor, administrator, or other person who has the authority under applicable state law to act on behalf of the decedent or the decedent's estate. In Tennessee, the only statutory definition for personal representative is the person who has received the legal authority over the decedent's estate. However, oftentimes a widow or widower or next of kin may require medical records, and probate of the estate is unnecessary because of estate planning or because the remaining assets are so small it doesn't pay to open and close an estate. Hospitals receive requests all the time for decedent patients' medical records from the patient's next of kin or from attorneys providing HIPAA authorization forms that are signed by the next of kin. To remain HIPAA compliant, these requests are legally denied. Under Title 63, there is authority given to the next of kin to request the decedent's medical records. But under Title 68, that covers hospitals and facilities, there is no such language. So what this bill proposes is that hospitals and like facilities have the next of kin language placed in it. So at this time, a person shouldn't have to go and engage an attorney and go to court to have a legal representative appointed many times. And the amendment picks up all facilities that are covered under Part 2 of this chapter. So that takes in nursing homes. It makes it clear nursing homes, freestanding surgical clinics, and even facilities that we don't even know about in the future. So, Mr. Chairman, that's a quick explanation of the bill. I'll be glad to answer any questions.
Do we have any questions for the sponsor of the bill? Okay, seeing none, we are voting on House Bill 1639 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Your bill goes on to calendar and rules. Right, that brings us to item number 3, House Bill 1678. I think Chairman Hawk, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. I was a bit distracted by the orange jacket on the front row, but I think I can still continue after I take a deep breath. Thank you. Ladies and gentlemen, House Bill 1678 is a bill brought to us by the administration, and it's correcting a couple of shortcomings that we have seen over the last couple of years. When the Health Facilities Commission separated from the Department of Health, the reporting of hospital discharge data was inadvertently transferred to the Health Facilities Commission. This bill will transfer that reporting data back to the Department of Health. Additionally, the bill adds the collection of discharge data from birthing centers so that the department can analyze additional information about births occurring at this type of facility. Birthing centers are being used more and more, and we're just making sure, just collecting the data on these discharges as well. Additionally, the bill will delete the requirement that hospitals that have shut down must submit a final joint annual report to the department. The comptroller reported to the Department of Health recently that upon these closures, there's been no one there to file that report, and they're filed yearly, so they're mostly financial by nature. In a nutshell, Mr. Chairman and members, that's what this bill does. Look forward to affirmative votes.
All right, thank you. Any questions for the sponsor of the bill? All right, question has been called. Without objection, we are voting on House Bill 1678. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and members.
Thank you. All right, that brings us to item number 4, House Bill 1679. Representative Martin, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman, and I'm appreciative for my third cousin twice removed, Representative Brock Martin, for getting the memo today.
Okay. And we understand you do have an amendment?
I do.
Okay.
It's 012761.
Okay.
and
You have a
amendment
motion.
Makes the bill.
Okay, you have a motion and a second. So without objection, let's vote on that amendment 012761. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Mr. Chairman and committee, as amended, this legislation will expand dental care across the state of Tennessee by increasing the number of dental hygienists that can be supervised by a dentist from 3 to 5. The current ratio underutilizes the workforce of dental hygienists employed by the state, county, or municipal metropolitan health department. And with allowing more hygienists to work under the supervision of one dentist will allow for a higher access of dental care in underserved communities. Tennessee ranks 45th in dental access. There are 8 counties without dentists. This is amendment, and this bill will be something that will help some of our underserved communities across the great state of Tennessee. With that, I stand ready for any question.
Thank you. And to just clarify, the private practice dentist, it does not change.
It does not.
Okay. Any questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 1679 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you.
That brings us to item number 5, House Bill 1683. Representative Burkhart, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. This is legislation about the drug buprenorphine. This is a cleanup bill from the administration, simply getting in line with federal law. The waiver data removed, Drug Addiction Treatment Act was removed from the federal law back in December of 22. And this bill simply just cleans that up and also gets Tennessee code annotated in line with that. Again, this is an administration bill and it's also a cleanup bill. There's no fiscal note on this bill. I do have some people from the department if there's any questions. And with that, Mr. Chairman, I would entertain any questions.
All right. Do we have any questions for the sponsor of the bill? All right. Representative Hicks, you're recognized.
Thank you, Mr. Chairman, and thank you, Representative Burkhart, for bringing this. Since December of 22, I think there's been a lot of, questions on how the state would move forward since the federal government took the X waiver off. And I think this explains that the state's going to stay pretty stern on what they believe treatment looks like in the state of Tennessee, and we're glad for that. So thank you for bringing this bill. This affects a lot of people. I know that people, just sometimes that's not spoken, but it affects a lot of people and it helps a lot of people. So really glad to get this straightened out and Tennessee can move forward. Thank you very much.
Thank you, sir.
All right. Okay. Any further questions? All right. Seeing none, we are voting on House Bill 1683. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
Well, that concludes our calendar of the day. Seeing no further business before us, we are adjourned.